I am on a live. Do you need me? You can tell me. I mean, without patient information. So we are gonna look up the self-payment options for GLP-1 receptor agonists in 2026 today. As you know, most popular GLP-1 receptor agonists, the weight loss medications are Wegovy, Zepbound. We're going to look that up together, and then I will just tell you some tips. So first of all, I'm checking. Happy New Year! I'm checking Zepbound. So I'm gonna go. Oh, let me share it. Let me just see Zepbound Eli Lilly. This is the Eli Lilly website, and you can see those medications. And the price is gonna be, what's the price? Why can't I? Okay, there you go. The price is gonna be, so I'm saying FDA approved, free delivery, vial. So this is vial and strength. I click the self-pay, right? And self-payment price is gonna be, I think I have to click the strength. Okay, so if you the initial dose 2.5 milligrams at pound, if your insurance declines it and you just decides to buy it over the counter, it decides to buy it as a 100% self payment, you are going to be paying $299 per month. Still very expensive, but compared to what it used to be, much more affordable. But I get that this is still expensive, and too soon to be surprised because it's gonna go up to 400 with the 5 milligram, and the maximum dose is 15 milligram, as many of you know. 7.5 milligram is gonna be 500 again, and it doesn't go up anymore. So 5 milligram is gonna be $400 a month, and from 7.5 milligram it's gonna be $450 a month. It's not gonna go up anymore, so the price is gonna be $450 a month. And we don't want to pay this, so that's why we do something called the prior authorization. Prior authorization. Oh, hi, Dr. Lee. Hi. So prior authorization is a process that we, as a doctor, we appeal your insurance saying, hey, somebody, this patient needs a benefit from this medication and I want you guys to pay for it. And a good prior authorization is the key, depending on how you do it and how you appeal, what information is included. The test result, the prior authorization outcome could be different. We have many of our patients who were referred by other provider, and they say they already tried prior auth for certain medicine, and we do the same thing. We same medicine and same medical condition. We do the prior auth, and we oftentimes get it. So the prior authorization will be the key. And one other common question I get is people tell me, hey, I have some condition. Like we know that there are so many conditions related to the obesity. For example, someone who had a bilateral both knee replaced, and they come to me and they say, obviously we all know what it came from, and they say, well, how come my insurance doesn't pay for it? It could be some other condition like a lower back pain. Yeah, but we know that it's related. The thing is, not every condition related to the overweight or obesity is going to affect the outcome, prior authorization outcome. Your insurance isn't always going to pay attention. So what really matters is whether somebody ran a study, large sized, high quality study, and proved that this medical condition will get better with Zepbound or Wegovy, and then FDA agree with that, agree with quality of story, and they say, yeah, that's true, and FDA approve that medicine for that certain diagnosis, then that may affect the insurance coverage. So one example is sleep apnea. Sleep apnea is known to improve when someone use Zepbound. So Zepbound is another indication. The sleep apnea is another indication for Zepbound. So we oftentimes do a home sleep study when we highly suspect someone to be on the sleep apnea. Someone who tells me I snore all night and my wife saw me stop breathing at night. We know this guy must have the sleep apnea. It's just never been diagnosed. So then we have to do a sleep study. It's not going to be like, oh, I want to get the medication, so I tell my doctor that I stop breathing when I sleep at night. That's not how it works. We have to prove that that this condition actually exists with a sleep study. In the past, we used to wait so long to get the sleep study done. You have to first, you had to, not anymore, you had to see a sleep medicine doctor, which takes months. And then they schedule like a lab, a sleep center sleep study, which takes another like couple of months. But not anymore. Nowadays, the home sleep study is so well developed. So if you we use something called a LOFTA. LOFTA is a, let me show you. LOFTA home sleep studies. So it's a company. This is not an advertisement, by the way. LOFTA company, as you can see here, this guy has some sensor here, and sensor here, and he just sleep on his bed. And next day I get the test result, the next day or the day after. So you can do home sleep study from home without like long waiting. Last time I helped our patient to get it scheduled, I saw him paying in my exam room, and he paid it. There, a questionnaire popped up, so he filled out the questionnaire. He entered his basic metabolic, like basic medical information. His medical condition, and once that questionnaire was submitted, he was able to see the calendar where he can schedule the appointment with sleep medicine doctor like remotely. And the sleep medicine doctor, they were available like on the same day. We did it around like at 3 p.m. on that day, and he was able to talk to them on the phone at 5 p.m. on that day. And a couple of days later, he got the kit arrived, a mail to him. And as soon as he put the monitor, the sensors, and then sleep, couple of maybe 2-3 days later, I get beautiful like an interpreted sleep test, a sleep study result. And based on that, I appeal your insurance. So that's how it works. So I want you to understand, it's not just whether your BMI is greater than 30 or not, or whether you have some condition related to the obesity or not. This is more like there's a certain regulation and requirement for that, and that's what I just explained to you. And one other indication, not as like strong as the sleep apnea, but also very important, is fatty liver disease, fat in the liver, fatty liver disease. So the fat, when we gain weight, and the fat doesn't always stay under the skin. Sometimes it can stay, it can be located surrounding the organ, and even inside the organ, like inside the fat. We call that fatty liver disease. And fatty liver disease more directly affect your metabolism. Like, liver is a very important organ where our body deal with all the insulin and glucose and glucagon metabolism. And fat inside it will obviously affect the metabolism and causes metabolic syndrome. It causes diabetes. It may lead to diabetes or high cholesterol. So when we see not only overweight or obese, when we actually see that the fat is now in the liver, and even though somebody doesn't have diabetes, it's going to eventually cause diabetes, and that may affect the insurance approval. So that's why we have a FibroScan, the machine that measures the fatty liver, fat amount in the liver, next door, and we just do it to increase the chance of insurance acceptance. So these are the medical condition, and the other popular medical conditions related are like, if someone has a proven heart disease, like a coronary artery disease or a severe heart attack history, myocardial infarction history, or peripheral like artery disease, like a circulation issue, someone with a history of stroke, these type of really advanced like an end stage like a complication from the obesity, they also affect the result, the prior authorization outcome. So we have to include all these related medical conditions in the prior authorization and submit it to the insurance. But that's not the end of it. When we get the decline, I always tell our patient, hey, please keep the letter and bring it to me. We have to read the letter. Oftentimes they say, oh, we declined it because of this reason, which is not always true. And if the insurance says we're not going to pay for it for financial reason, and there's nothing I can do about it. I'm a medical doctor. I don't have any right to. I don't have any authority to kind of override their financial decision. But if they are declining the medication for some like a medical reason, which is not true, then I can always prove that. I can always correct that misunderstanding, and that often leads to the approval. And we can always appeal twice, and this oftentimes leads to peer-to-peer review. This is really most aggressive form of doctor's appeal to the insurance. We are talking to the doctor who worked for the insurance, and kind of, we're not debating, but kind of, convincing them why I'm prescribing this medication. And this often works. So this is how our team work to get the medication. And next, let's see, Wegovy, Novo Nordisk, Wegovy. And the Wegovy is now, oh, there you go, accept all. They have made oral Wegovy, Wegovy pill. Oh, yeah, okay. So Wegovy pill is the official name, and this is very new. Someone may say, "I know what that is." No, nobody knows what it is because it's not even in the market yet. This is very new medication. We had something called Rybelsus, which is same medicine, semaglutide, oral form semaglutide, but it was much lower dose, 3 and 7 milligram. But now it goes up to 25 milligram. It's proven to be safe to go up the dose, and it's proven to help further with the weight loss, and the efficacy is not any inferior compared to the injection semaglutide, which is injection Wegovy. They say like a little bit more weight loss compared to the injection. So this is something very new, and the reason this is important is because of the price. Where's the price? I don't see the price here, but oral Wegovy, I have a patient waiting for me, so I'm gonna leave soon. So I don't have time to, yeah, there you go. So starting at the initial dose, the initial dose 1.5 milligram and 4 milligram, the second dose, the initial price is 139, which is, I believe, the most affordable GLP-1 receptor agonist. And it's available only until April 15th. So if anybody want to try with this price, I think you have to call your doctor sooner than later. And then the price will go up to, for the 4 milligram, the price will go up to 200. And after that, up to the maximum dose 25 milligram, we have to pay 300. So 300 for the oral Wegovy, and the injection Wegovy is also, the price is got to be up. There you go. And no, where's the price information? I don't have cost coverage ways too. I don't know. It's not here, but my understanding is, I have to double check. Don't trust me. My understanding is the injection Wegovy price is gonna be 350 a month. Of course, I mean, a lower dose is gonna be a little bit cheaper, but the ultimate, the maximum dose is gonna be 350. So that's my understanding so far. And lastly, there are other medications that we've been using for decades, even before Wegovy and Zepbound came out. So if your insurance doesn't pay for those GLP-1 receptor agonists, and you can't afford the self-payment, that's not the end of the world. Always talk to your provider, and they may introduce other options. And also you can contact us, and we are more than happy to help you. So that was my quick live. Thank you so much for watching, and see you later.